While assessing lumbar range of motion, you'll typically have the patient standing, as sitting stabilizes the lumbar spine. So I'm going to have the patient reach down as if she's going to try to touch her toes. From here you can visibly see how the movement is happening through the spine. You could also, come on back up for a minute. You can also feel, go ahead and come all the way up. You can also feel as she goes down what's happening through the hips. Go ahead down for me one more time. And be able to tell if there's some rotation or some abnormal movement through the innominate. So once there, you can test for passive range of motion. I'm going to stabilize at the sacrum. Good, and have her come up just slightly. Now don't let me push you down. Good, and come on back up. Now I'm very careful to do this. If it's an acute patient, I'm probably not going to be applying any overpressure or resistance, especially if she's really easily flared up. So when looking at extension, I'm going to have you put your hands on your hips. Usually this can be a little bit protective if someone is painful. And go ahead and arch back as much as you're comfortable. And again, I'm watching. As much skin that can be visible is ideal. And then go ahead and come up back up straight. And again, I don't like to overpressure or provide resistance into extension. But by being able to see the spine, again, you're looking at how well are each vertebral bodies moving. For side bending, let's go ahead and have you turn this way. For side bending, I'll have the patient tip over to one side and just slide your hand down along your leg. And again, you're looking for a nice smooth curve in the spine. Here, to stabilize, you put one hand on the opposite hip, and I'm going to give her some overpressure through the shoulder, and then I'll have her come back up. Now, go ahead and try to straighten back up for me. Good. And there's the resisted motion. Same thing going to the other side. Slide your left hand down. You can use this as a measure if you're trying to document how much movement the patient has. 1 inch below the knee line or 2. And again, stabilizing the opposite hip, giving slight overpressure at the shoulder. Have her come back up, and don't let me push you down further. Good. And so rotation, again, I will typically just do this visually. I'll have the patient cross her arms. Because she's standing, we're not isolating it to the thoracic spine. So I'll have her twist to one side like she's looking over her shoulder. Good. It's a little harder here to provide some rotation, so I typically don't do the overpressure resistance, just because now you're levering through the whole spine, so it's a little bit more difficult to isolate. And to the left, active range of motion.